My name is Karina Kielmann. I'm a professor of health systems research. I work in the Institute for Global Health and Development, and that's at Queen Margaret University in Edinburgh. I work on 3 different areas at the moment. I'm looking at how health systems can better support the needs of men whose livelihoods are dependent on occupational mobility, and that's in Uganda and Zambia. The second major area is looking at how underserved communities, in particular migrants and people of ethnic minority, how they can be better served by primary care. And so we're looking at the role of pharmacies in particular as access points. And the third area of research is looking at how community-based organizations in the UK can support men's mental health. My approach has been very much informed by a kind of dual training and experience. I trained originally as a medical anthropologist back in Canada, and that anthropological lens has stayed with me. It means that I'm very interested in human experience. How do people experience illness? How do they go about managing it? How do they navigate health systems? On the other hand, I started working back in the early 2000s in global health. And that perspective was much more oriented towards health systems and service delivery. So how do we make the services and systems more responsive to the needs of people? And that those two lenses, medical anthropology on the one hand and health systems research on the other, are kind of what shape pretty much everything I do now. All of the research that I do is looking at how do you make health systems work better for people. And that is from 2 perspectives. One is from the perspective of users, and that's a concept that we use often is responsiveness. How can the health system be more responsive to the legitimate expectations and needs of people, including people who may be disadvantaged for various reasons? And the other concept is from the perspective of the system. So it's about health systems readiness. So how can we generate evidence that supports health services, health managers, health workers to be able to deliver a new intervention, a new technology, a new treatment in a way that is effective, that's sustainable, and that also fits with the existing resources and constraints. So I think there's 2 ways that my research has an impact. One is in bringing the voices of people whose voices may normally not be heard. So by hearing their stories, their accounts of how they experience health systems, we get a better understanding of how health systems can be designed to address their needs. The second example is of bringing different groups of people who normally have different stakes in the health system, practitioners, policymakers, insurance system holders, etc., into the same room to discuss the likely trajectory of a new intervention. And that's also a really important way of allowing a dialogue to happen that normally wouldn't. So I'm really interested in collaborating with multidisciplinary teams, and by that I mean 2 things. One is that the research-practice interface is absolutely critical to ensuring that research leads into practice or leads into policy, otherwise it just stays on the shelves. The other thing I'm interested in is working with community-based organizations and non-governmental organizations, and that's to ensure that community-led efforts to improve the health and the well-being of communities is taken into account in efforts to strengthen primary care. And that's in the UK, across Europe, as well as in the African contexts that I work in.